Thanks, Anne. You set me up very well for this next presentation. So I'm going to talk about the Baltimore Food Policy Initiative, food deserts and food access solutions. So I want to first give you a quick overview of the Baltimore Food Policy Initiative. So to start, Baltimore City has an Office of Sustainability, but we also have a sustainability plan. In our sustainability plan, we have a goal, greening goal number 2, I refer to it, establish Baltimore as a leader in sustainable local food systems. To me, that alone is quite innovative. That here in a city, in an urban environment, we have a goal to have a sustainable local food system. My favorite slide I like to use, food system is a word that many people are starting to use. It has some jargon to it, but I really want to define it for the context of today's presentation. This is from the Mott Group from Michigan State University. It's still my favorite diagram, and I would like to use Great Kids Farm as an example. Great Kids Farm is a farm owned by the Baltimore City School District, and it's around a 30-acre farm with around 5 or 6 acres in production right now. And I'm going to explain the food system through this farm. So the kids grow organic produce. So you're looking at the inner circle right now. And then it creates jobs. Kids are learning how to grow food. They're learning how to then sell at the Waverly Farmers Market, where they accept SNAP benefits or food stamps, which is creating healthier individuals. So in this model, we're looking at one example of how a farm and kids are creating a local sustainable food system. Okay, so within this plan, our goal related to food access is to improve health outcomes by increasing access to healthy, affordable food in food deserts. I want to spend a moment to define food deserts. And the work that we're using in Baltimore City on food deserts is really because of Johns Hopkins School of Public Health and Center for Livable Future, and Anne and all the folks in her shop. Around 3 years ago was the first definition of a food desert and the first level of maps. Since then, we've been working together to come up with a food desert map and definition that really resonates and takes into consideration the food environment. Now, as Anne was mentioning earlier, there's different stories or studies saying that this is good or this is bad. You may have seen in the New York Times several times now about food deserts and some thoughts and questions on those issues. What we have found with our work is the initial definition that Johns Hopkins had was really a binary approach, which is how far away is a grocery store and is in a low-income area. And that is currently the USDA food desert definition is that. They're saying 1 mile from a grocery store and a low income. Now, what we've decided in Baltimore City that indicator will not work well for us, and that we have 4 key components to our definition. For Baltimore, a quarter mile from a grocery store, because that is the most people are likely to walk. And if it was New York City, you might have a different definition as far as distance. Our public transportation, I think there's more to be desired, and that we need to take into consideration walking and how long buses take and so forth. So we included the low vehicle availability, low income at or below 185 federal poverty level. But this is the most interesting piece, and Anne already alluded to this, low healthy food availability score. So with Center for Livable Future, they went through and scored and did a healthy food availability score for every food retail establishment in Baltimore City and gave it a score. So just so you understand, it is an index score, but a corner store or convenience store will have a low score somewhere between 1 and 7. A full-service grocery store somewhere in the high 20s is your range. And so the reason why this measurement was very important in our new definition is that we want to understand that the food environment impacts health. So what Anne was already talking about, there's 164 corner stores and convenience stores in Baltimore City's food deserts. By definition of a food desert, there's not a grocery store within a quarter mile. So where are people going to eat? What's convenient and close to them? With not having a lot of time on their hands, making that assumption, they're going to eat where the food is. And so that was another piece that we really wanted to think about. And so we're working with USDA in their revisions and drafts for the next definition of food deserts, because big cities, and Baltimore, with a population of 625,000 people. But I mean, Boston, LA, New York, Chicago, some of these bigger cities as well, are having the same findings as we are when you look at the USDA food desert locator. We don't really have any food deserts according to that map, because density isn't always taken into account. And so we're working with USDA to really look at how can these cities that have a lot of food deserts and food access issues be represented on their USDA map. And they've been a great partner as we've been developing and working through those issues. So as far as what does food deserts really mean to Baltimore, 20% of the city residents live in food deserts, 120,000 people. That's 1 in 4 kids live in food deserts. What I thought was interesting in the most recent analysis of this map, approximately 83% of the residents are employed. I thought that was interesting. Being in a food desert, and by definition of a food desert, we're talking low income and poverty areas, meaning that we really need to be taking into consideration underemployment, and the fact that we need to create more job opportunities in this area as well. And it's maybe that people are already working 2 or 3 jobs, so higher paying jobs. And this last number is something I need to continue researching with Johns Hopkins on this one. Our numbers for SNAP benefits in food deserts was 24.5%. I really expected to see those numbers in food deserts much higher. So that's a new figure we just started to unravel a few weeks ago, and we're going to dig a little deeper into that one of why. So the Baltimore Food Policy Initiative, as far as the organizational structure goes, as we know, food intersects many government agencies. It's not like there's just one agency in city government, state government, or federally for that matter, that all food is related to. It's in transportation, it's in health, it's in planning, it's in economic development. It intersects so many agencies. So that's why we have the Baltimore Food Policy Initiative, which is really 4 agencies. It's a Baltimore City Planning, a Health Department of Sustainability, and also the Baltimore Development Corporation. They're the 4 key lead agencies. But we understand that government alone cannot solve the issue of food access. And so we have FoodPAC, Food Policy Advisory Committee. It's Baltimore's equivalent to a food policy council. And it is growing. It has 60 members currently. It's 35 organizations represented. My goal is that every organization in Baltimore City that has anything to do with food access, nutrition, gardening, cooking, health will be a part of FoodPAC. They are not a decision-making body. The goal of this is to be able to help implement the 10 Food Policy Task Force recommendations, which I'll talk about in just one second. And one thing I realized, I was born and raised here in Baltimore, but I was out in Washington State for 15 years and just moved back around 2.5 years ago. I realized coming back to Baltimore that there was a lot of silo work. There was a lot of great work happening here and a lot of great work happening here, but they didn't know about what each other was doing, and everyone's trying to work on bare-bone budgets here. And so one of the goals with FoodPAC is really increasing collaboration among FoodPAC members. Okay, here are the 10 Food Policy Task Force recommendations. Prior to my hiring on my position, so it was 3 years ago, the mayor at the time, Sheila Dixon, said we need to establish a food policy task force. So the planning department and the health department became the co-chairs. Ann Palmer was actually one of the key leads on this task force as well, and developed out with 18 key stakeholders the 10 key priorities for Baltimore City as it relates to food access and food issues. And so when I came into this role, this was sort of my worldview. I came in not needing to figure out what to do, but here are the 10 and sort of the timing and the details related to these 10 issues. Okay, so now I'm going to move into more details related to the food policy task force recommendations. So I have 3 key areas I'm going to talk about related to this. The first one is around healthy food retail and food deserts. Okay, so the virtual supermarket. One of the goals, with the First Lady and the Let's Move is to eliminate food deserts in 5 years from now. And we know that building grocery stores is very important, the brick and mortar grocery stores. But we also understand that it takes, if you're lucky, 5 to 10 years to get a grocery store into a neighborhood. There's a lot of costs, a lot of loans, a lot of logistics and expenses to do so, and we need to do those. But there needs to be things we can do now. We need to be able to bring food access into communities now, not 10 years from now. So the virtual supermarket is a really innovative solution to that. The health department runs this program. Its history started in libraries located in food deserts. It's a private-public partnership between Santoni's, an independent grocery store, and the health department. And so Santoni's already had an online ordering system, a web-based system for ordering food. And so what the goal here was that you could go to a library at first, and then there'd be a health department coordinator there who would help you order your food online. They'd provide a computer, they would put the food in, order the food, or over time they realized that there was a lot of people who had their own computers and they wanted to order their food whenever they wanted to and not have to come to the library to order the food. So they got a promotional code, and then now today, if you're anywhere, a public computer, private computer, you could go online and order your food, and then once a week pick it up. And so that was really the beginning origins, was starting with libraries. As of probably around 5 or 6 months ago, they've expanded that model, and I really believe that this is the model that has national ramifications. Right now they have expanded into senior and disabled public housing. And by the end of the summer, they will also be in family public housing, which is great because, our public housing could have from 100 units to several thousand units. And the convenience of just being able to go into your lobby, order your food, and then pick it up down in your lobby is way more convenient. It's really hard, as Anne already mentioned, to change food purchasing habits and food behavior. People have a hard time thinking of going to the library to order food. It was innovative because the libraries are all throughout food deserts. They're very easy to access. They're walking. It's a really innovative solution, and we're continuing with the libraries. But I think public housing and really understanding convenience is key here. And that we know with this strategy, it needs to be pooled ordering. So it's not a matter of like a Peapod or a model just going from door to door to door. We'll be able to bring in the amount of money, but when you have the pooled ordering at one site and there's 10, 20, 30 orders per week, it can be a very viable option for grocery stores. With this being said, Baltimore is the only city in the country right now that has this model, and there is a reason for it. Santoni's, our grocery store, independent grocery store, is willing to take payment at the time of pickup because there's 26 federal policy barriers prohibiting online use of SNAP benefits. So, a large grocery chain is not going to be able to take an order, go get all the food together, and then bring it to a site and then take payment. What if people don't show up? Now, we like to use the analogy here in Baltimore. How many of you go to a grocery store, fill your cart full of groceries, and walk out? You've already invested so much time, you don't do that. And that's what we have found in Baltimore with the virtual supermarket. So it's not really an issue for Santoni's, but if we're really going to address food deserts nationally, that the virtual supermarket has a national implication for it. But we need to, and we are working with USDA. Actually, I think it's in the language for the Senate for the Farm Bill. They mentioned online SNAP pilot projects through FNS, Food and Nutrition Services, which we're hoping that Baltimore could be one of those. So we really do want to see this become a national model. Okay, public markets. We're one of the only cities in the country that still has many public markets, a whole public market chain. And when I mean public markets, I'm talking about covered historic markets. We have 6 of them in Baltimore City. I'm not referring to farmers markets. I'll get to that in a few minutes. So these were our historic markets, before the times of grocery stores. They were where everyone came to sell their foods and goods and where everyone shopped. Over time, the public markets reflect their neighborhoods that they are housed in. And so we have 6 public markets in Baltimore. Lexington Market is the largest and most well-known market. And what we have found, we did a healthy food assessment of these public markets about a year ago. And there was 2 key findings we found. 1, 4 out of the 6 public markets are in food deserts. 2, 70% of the food in the public markets are carryouts. Baltimore, we use the word carryout. We don't use the word fast food. Carryouts are more independently owned restaurants, whereas fast food we refer to as more a chain restaurant. But they could be interchangeable if you think about it nationally. So anyway, it's prepared foods. So 70% of the food in the public markets are prepared food. And so what does that really mean? It means that our public markets, where we're in food deserts, is contributing to the density of prepared foods and unhealthy food choices in our food deserts, where there's an absence of grocery stores. So we took this really seriously and want to see how could we figure out a solution for our public markets. And so working very closely with Joel Gittleson and Sung-Hee Lee with Johns Hopkins School of Public Health, they've been doing prolific research on healthy carryouts and healthy corner stores. And we took their research tools, and their researchers for that matter, and been working very closely with them to take their model and apply it to the public markets. And so we developed out a healthy carryout model where we currently have piloted 10 carryouts in Lexington Market. With our more recent funding from Kaiser and Able, we are now expanding into 22 carryout vendors at Lexington Market, 8 carryout vendors at Northeast, and it looks like we'll be going into Holland's Market as well. And the goal here is to work with the current retailers. That's very important to start with, is that there's 2 strategies. The first strategy is we already have carryout vendors in the public markets. We want to work with our current vendors and help them sell healthier foods and make money selling healthier foods. If they can make money selling healthier foods, they will sell healthier foods. And what our assessment showed is that over 50% of them on their menu or in their contract said they were going to sell healthier food choices, but they were not currently selling them. And so we asked them, on your contract, it says that you're going to sell these foods, and why aren't you? They said, well, I tried selling them, no one buy them. And so it's not a matter of just one carryout at a time trying to figure out the demand issues and trying the new foods, but if we can have many carryouts at the same time working on the issues, we could really start to move the needle on the issue. So we have these 10 carryouts. We've done an analysis of their menus. We actually gave them menus where we're highlighting the healthiest foods relative to their menu. We're making an assumption here. The assumption is you're standing in front of the carryout and you are buying food. You're eating lunch here. And if you're eating lunch here, how can you choose the healthiest food on that menu? And so that we launched with the mayor and Dr. Perman in a press conference this past spring, and that we've been getting some really good feedback on those issues. But we understand that a carryout strategy alone is not going to be enough. We really need to increase demand for healthy food purchasing. We're looking at doing that. One is through cooking demos and nutrition education, of course, but it's also looking at financial incentives, meal deals. And Reading Terminal in Philadelphia has a great model for meal deals, a $7 meal deals. And the goal here, remember, is to drive more people to buy the healthier food choices at the carryout vendors that we're working with, so they can start to see they can make money off of this. And so the meal deals will help increase incentives towards that. And the third part is really to increase more local farms and local vendors in the public markets who are preparing, whether they're making their own food, growing their own food, or making their own crafts and arts, to have that represented into our public markets. Right now, they're not really well represented, and we want to see a change on that. And the third area, which is really the one you hear the most about nationally around addressing food desert issues, is bringing in grocery stores. So Howard Park Grocery Store is a grocery store that we've been wanting to see a grocery store in Howard Park for a long time, for over 10 years now. We received healthy food financing funds, federal funds for around $760,000 to help make this grocery store happen. It is going to be a ShopRite. It's actually Jeff Brown's ShopRite with Klein Family Markets. He's done quite a few of the grocery stores in Philadelphia and food deserts. It's a really successful model. We're looking forward to seeing it here in Baltimore. And what makes it successful is one key thing is that they invest a lot of money in job training, and they really try to employ people from their neighborhood, train them well, and have them be working in their neighborhood through the grocery store. This specific proposal is we'll have a commercial kitchen. There's an elementary school across the street, and Chef Connie, and she has been doing catering with her kids this elementary school. And the kids just actually catered an event for the mayor and the governor a few weeks ago on the launch of the HBO salad bar program. And it was amazing, but they really do need a kitchen. a larger kitchen. And so there's going to be a commercial kitchen in this grocery store for them and for other food entrepreneurs. Okay, so I just talked about sort of the healthy food retail piece. Now I'm moving on to Homegrown Baltimore, Grow Local, Buy Local, Eat Local. The mayor actually titled this herself. And the goal really is how to grow farmers and how can farmers sell their food and create a local food system here in Baltimore. So to start, the first part is around supporting urban agriculture. This is one of the Food Policy Task Force recommendations. We're a city that will be growing very soon, but for the last decade or so, we have been more of one of those shrinking cities. So as a result of that, we have a lot of vacant land. And so we did a vacant land assessment and looked at, can any of this land be used and conducive for urban agriculture? And I need to take a moment to define urban agriculture because everyone defines it differently. And I think we in Baltimore City are defining it very specifically, so I should define it for you. So when I'm talking about urban agriculture specifically in Baltimore City, we're talking about farmers who are trying to sell for production purposes for sales. I'm not referring to community gardens right now for the sake of this conversation. It's really those who are trying to be full-time farmers or trying to make a livelihood off of farming. And so we looked at this vacant land assessment, saw around 20 acres or so that would be conducive for urban farming or that we thought would be conducive for urban farming. We did a national lit review around the country, if I remember correctly. Center for Livable Future was very instrumental in helping us do that lit review to figure out all the other cities and entities that have done a request for qualifications for urban farms on publicly owned land. So then we put together a request. We had 10 farmers apply, 5 farmers pre-qualified, which was important for me for 2 things. One, it made me realize that we have to have a farmer training program in the city. So we partnered with Future Harvest, and they're doing an urban farmer training program so that we would like every farmer who wants land to have land, and they need to qualify. So we want to make sure they're trained and are able to qualify. That was number 1. Number 2 is, so now we have these 5 farmers, and we're working with them on finding the most appropriate land for them to farm. And through this process, this 20 acres or so, what we realized is that the farmers who are trying to make a full-time livelihood on this needs the very best land possible. As we know, nationally, it's hard to make a livelihood off of farming. And then add it into a city, and they really need to have the very best start possible. So we're working with them to find the best land. And in the meantime, we realized that we needed to develop out sort of a new kind of farming in the city, the market gardener. So it's the person who had their own community garden, or they had their own plot of land. They really like growing food. They're growing more and more and more, and suddenly their family and friends can no longer eat all their food they're growing, and they want to sell some of it. And so we're really looking at creating that opportunity in the city through some of these smaller plots that we have, less than an acre, for our market gardeners. And then obviously we have well over 100 community gardens in the city, and we want to support their efforts. And one of the ways that we're supporting their efforts is up until around a year ago, they were pretty much, I think it was a 1-year lease, and they had to keep renewing every year. And now we're moving many of those into 5-year leases to give them a little more stability. So that's one area around sort of urban farming. Another piece is that we have our proposed land use zoning code that we've been working on. And in our current code, it made it so that farming was not permissible in the city. And that's why we didn't see any farms. We saw an example of Great Kids Farm and Real Food Farm because they were on school land, and that was okay. So in our proposed zoning code, that we made it permissible, 1, to farm, and 2 is like if you have a community garden and you want to put a farm stand out to sell your extra produce, you can now. So we're trying to make it easier for farmers to grow and sell their food in the city. And then there was sort of the whole high tunnels. You see here, this is an example, from the hoop houses, or we call hoop houses or high tunnels, is that we started to see more and more and more hoop houses popping up literally overnight in Baltimore City, and realized, we better change our building code because, the building code hasn't been revised and it has no language to high tunnels or hoop houses. So we changed the building code so that it's permissible to have hoop houses in the city as well. And the last point I want to talk about is animal husbandry regulations. In all honesty, this was just we were really fortunate on this one. We've seen and watched cities all over the country struggle with sort of the changing of animal regs. How many chickens can you have? Can you have chickens in the city? Can you have more than 4 chickens? And it could go on forever. In Baltimore, it was a week because what happened was that the health department it's a regulation. It's not a health code. Because they had an animal regulation that they were reviewing every so often, every so many years, that we realized that they were going to be reviewing it and said, hey, you know what, could we look at this regulation and see what's in here, and could we put some recommendations of what we would like to see? And so we looked at it, and it had 4 chickens to start, and we were able to change that regulation from 4 chickens to 10, space dependent. Same with bees. We went from, I can't remember the details of how many beehives you could have, but it went from maybe 2 up to more, depending on the amount of space. And then we also were able to include rabbits and miniature goats into the animal regs. And it was really just a very nice, quick one. It's always nice to have some nice low-hanging fruit. So that's really the support urban agriculture piece of Homegrown Baltimore. Moving on to sort of the market share piece of buying and eating local food. Baltimore City has 20 farmers markets. As with the national trends, we have actually 8 machines that have EBT machines at farmers markets. It's 7, but I'm counting July 1 is coming up so soon. I'm counting it in my number. Our largest farmers market, Baltimore Farmers Market and Bazaar, has received funding from Kaiser Permanente to have SNAP benefits offered this summer. And we have received Baltimore bonus bucks or double incentive dollars to incentivize those who are on SNAP benefits to come to the market. And for every $10 they spend, up to $10, they can get $10 more in produce or in food eligible for SNAP benefits. What we realized, we did a farmers market assessment, and pretty much my conclusion of this lengthy assessment was if you wanted to set up a farmers market in Baltimore, good luck. Because the regulations that we were putting forth in the city, it wasn't that they were any more than anywhere else in the country, but there was no guide. No one was saying anything consistent of, okay, you want to set up a farmer's market? Here's your guide. You know, this is who you need to talk to. This is what you need to do. It should take you X amount of months. You just need to get this in by this time. Pretty much, it took me a long time to figure it out because I had talked to so many different people and got so many different answers, and realized that all we really needed in the city was a guide, and to simplify some of the permits and how the permits were organized. So we're trying to make it easier to set up a farmer's market in Baltimore. And I think those are really the key pieces related to farmers markets. And the last area that I want to talk about is around healthy eating marketing campaign. As Anne was talking to about marketing and how marketing of foods really influence our food behavior habits. We had a 1-year grant in collaboration with Associated Black Charities and Fox 45, and Kaiser was a key funder for Get Fresh Baltimore. And the initial goal for Get Fresh Baltimore was really around public service announcements. And we had these great 5 public service announcements. And by the way, this whole PowerPoint is hyperlinked. So if you click on the top of every slide, you will then go into more detail, and you can see the 5 public service announcements. So these great 5 public service announcements on where to eat and get fresh fruits and vegetables, whether it's a virtual supermarket, farmer's market, Great Kids Farm. But we realized that we could do so much more than just public service announcements. So we collaborated with University of Maryland Extension and the school district, and we had 2,000 elementary kids create fruit and vegetable ads. We then took those ads, and with the support of the mayor's office and free ad space on the buses, we had 250 of the kids' ads, individual original artwork in the buses. It would have been way cheaper if I just took one of the best pieces and make it an art contest and take that and multiply by 250, but that wasn't the goal. This goal was not about an art contest. It wasn't about one kid, having the best piece of artwork. This is about having 250 kids influence and be proud of creating an ad that can influence people's behavior choices. And that's really the goal. And that's why we had 250 individual ads in the buses. So they were inside of the bus, they were outside of the bus, they were on the light rail, the metro rail, and so forth. And we have 7 key messages. You can see 3 colors. Each color is a message. Get fruits and vegetables at your virtual supermarket, get fruits and vegetables at your farmer's market, goes on to grocery stores, schools, public markets, and so forth. And this was such a great, successful campaign that as a city, we're now using their artwork and the Get Fresh Get Fresh Baltimore message for all our healthy eating campaigns in the city. And then moving on to Baltimore City Schools. We're working with the school district around healthy foods in the schools. We established a Green Schools Network. It was called Sustainable Food System Action Team. And the goal there was to have everyone, once again, it was around a collaboration issue. We realized that there were so many different partners in the school district. That one school had this organization doing gardening, another school on the other side of the city had this great nutrition education class of extension coming in, but there really was not much coordination or collaboration of what strategies are being used in the school districts and everyone knowing what everyone else is doing. So that this team is really about increasing collaboration of nutrition, gardening, cooking, education in the schools. In addition, we have the Healthy Food Challenge Grant, where we had 11 schools write mini grants for $1,000 for a healthy food initiative in their school district. We're going to be having a celebration of their work in the next month. Let's Move Salad Bars, as you guys saw, hopefully all of you guys saw last night on HBO, Weight of the Nation. As a part of the Weight of the Nation, HBO, I think it was on May 1st, gave salad bars to, I think it was 20 school districts. I can't remember the exact number of 20, but I know we're one of them. And so Baltimore City School District received 10 salad bars. And that's really helping to launch our salad bar initiative. That brings us up to 20 salad bars in Baltimore City School District. Our goal is to have a salad bar in every school. In addition to that, we have the fruit and vegetable program. Last year, we had approximately 20 to 25 schools participating. Now we have 86 schools. And we really wanted to create a farm-to-school movement within that. So Great Kids Farm actually grew the microgreens and carrots for the fruit and vegetable program. I want to sort of set very quickly, before I conclude here, sort of the national perspective on food policy. So when I came in, I was probably one of several, definitely less than a handful, of food policy. The positions may have different titles: director, advisor, coordinator, but anyway, the key person in the city related to food access. And so with the assistance of Wholesome Wave, we developed out the Food Policy Director Network. To date, there's 10 cities with the equivalent of me included, so there's 9 other cities. So that's grown quite a bit in the last couple of years. And the goal really is that what we found is that even though we're all in different cities and our cities look very different, we're dealing with the same issues. So there's a lot of collaboration happening. But what I think is most exciting is the United States Conference of the Mayors established a food policy task force. Mayor Menino in Boston is the chair. Mayor Rawlings Blake in Baltimore is the vice chair. This was just established this past January in DC, and since then we've had a meeting in Boston a few weeks ago for our food policy, and we have already tackled quite a few issues. There's been several letters that they've written for the Farm Bill. And we've been working on the food desert locator definition, online SNAP benefits, and that this has been this is really one of the first times the mayors have taken a voice and a stance on the Farm Bill. And this task force had a lot to do with the mayors coming with a collective voice to talk about the Farm Bill. With that being said, when we started to think about cities and Farm Bill, I was wanting to make sure that the city was really thinking about the Farm Bill. And so someone in the policy shop said, well, how much money does Baltimore receive from the Farm Bill? I said, wait, that's a really good question. Let me figure that out. So Baltimore City, a population of 620,000 people. So just imagine New York, okay? But Baltimore City, 620,000 people, we receive over $1 billion on the Farm Bill. And that is for SNAP benefits. That's also, though, has been very important for our ag issues, for our community food projects in the city. And when you hear and think about SNAP benefits in the Farm Bill, you immediately go and think about those people on SNAP benefits who need to go to a grocery store to use the SNAP benefits. What we forget to realize are how much money our grocery stores are getting income from SNAP benefits. So if we're seeing huge reductions in SNAP benefits, it's not only impacting the individual using their SNAP benefits, it's impacting the retailers as well. And we did interviews with grocery stores, and one of our grocery stores located near a food desert, 80% of their sales come from SNAP benefits. So it's just a very interesting perspective to think about on both sides of the coin related to SNAP benefits. And that wraps up my presentation. Thanks so much.